Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we're going to talk about an important topic, which is malnutrition. And let's welcome our guest, which is Dr. Jamil Ahmed. Welcome you to our show. How are you doing?
Good.
Good. So tell us, what about malnutrition? A lot of people hear about this word, and it's a long word. So tell us what it means first.
You know, when we think about malnutrition, we think about Asia or Africa. A thin, dark-skinned person and half naked. Actual picture is, it is a worldwide phenomenon. Not only, yes, it's true, it is more common in Europe, not common in Asia and Africa, but it is present in Europe and also in America. And so it is just not a problem that is limited to a certain geographic area. Just give an idea how it happens. Suppose somebody gets, say, 3 meals a day and eats rice or cereal, no green vegetables, no meat, fish. They will have malnutrition, although they got enough calorie to maintain their weight. So that is also a kind of malnutrition that we don't think about. And in older population, that type of malnutrition is more common than we think. So that's how it is. It's been like all over the place. Like almost 2 billion people in this world has malnutrition.
Wow.
It's a lot of two out of 7 people. So it is not something that we can think that is other people's problem, because it's our problem too. Why we eat differently when we get older? Our taste bud changes. So we don't taste things the way everybody does. When you're younger, everything tastes wonderful and we ate well. And every older people will say, nothing tastes good. So that is a setup for weight loss. Along with that, they have a problem with swallowing. They have issues with the denture or dental problems. They don't swallow well. So ultimately, they get to the trouble that's expected. 10% people has nutrition problem in the United States as a whole. And if you live in a nursing home, that ranges between 10 to 70%. So majority of people who live in nursing home or assisted living has issue with the malnutrition. And issue is the same thing, difficulty with chewing, and they don't like the food they serve because they have a standard food. They didn't eat the same food that they ate at home. Some people say that I'm a meat and potato person, and when they go to nursing home, they get pasta. They don't like it, and they don't eat it. Some people it takes longer to eat. They don't have enough time to sit down with a person to feed them, and they don't have enough help because help is expensive. There is also a condition called anorexia of aging. That is also the same thing, like nothing tastes good. So when people have malnutrition, it's not about that they are gaining weight or losing weight. They have increased death rate. They die from infection. They have hospitalized more often. So as a whole, they have a worse prognosis than other people. So it is something you have to take it seriously when somebody is not eating well, because complication is just waiting to happen.
And that's the important thing is, there are portions in our system which helps us with feeding and eating, and that's kind of for audience to understand. So loss of smell is very important, and it can alter your taste. And with current situation with COVID, actually one of sign, some of patients came and say, oh, the food doesn't taste same because you have lost part of smell. So that actually olfaction is a very important part of when we eat. If it does not smell good, we're not going to eat. So we lose some portion of that, and also the taste buds with age, and that cause these lack of appetite, and especially in elderly. So that's very important to understand those concepts, that it is not simple just putting food.
Yeah.
It is actually the appetite really goes. The other problem is swallowing problem. So that is when if you have dentures or somebody has dentures, and we can chew well, then guess what will happen is it would not get absorbed well either. So it's very important to understand these small things, but they do matter a lot. Same stands for, so the portion in that we have to chew well, and then the swallowing starts. Now they could have problem with swallowing, that food get stuck, and they could have narrowing of the part of esophagus, or it could be other problem, could be a stroke, and the part which actually transfers from mouth down is not happening properly, or they are aspirating, so part is going in the wrong pipe. So those are very important things. So when we do these swallowing evals, we'll find that for you, for everybody to understand. Malnutrition is so important. So the question is always, can you be obese and have malnutrition? And so tell us about that.
As a physician, when somebody comes and talks about that, you have to run a differential diagnosis, or because it's so difficult to remember hundreds of things that goes on and can go wrong with you or me. So we have a mnemonic for everything, so that we don't forget to miss it or don't miss anything. There is a mnemonic called 9Ds. It means that starts with diarrhea. Diarrhea is common in older people, like constipation. If somebody has diarrhea for 4 weeks or more, that has to be taken seriously, because it will cause weight loss. And the reason we do that, because you have to find out whether they have any chronic disease like celiac disease, what he is eating, or you have a Crohn's disease, it's an inflammatory disease, and that has to be ruled out if he has a diarrhea. Then you have the depression, which is common in older people, because social isolation and the way they live and the change of status, and so they don't have the motivation to eat anymore. So we always check for depression, whether that is the cause. Then has dementia. Somebody is living at home, we forget how to cook. They forget to go for shopping, or they don't know what to buy. So I have to make sure that their mental status is good enough to be at home and cook for themselves. And that may be a simple reason that they are losing weight. Sometimes you go to a person's house and you find that there's nothing in the refrigerator. So because they don't know what to buy. So there is so many strategies you can do to compensate that, so that they can be at home for a long time. Then is the issue with chewing or dentation. And Dr. Mobi already discussed that, your chewing is changed, you have issues with aspiration, or you don't have the good taste sensation anyway. And then you have immune system issues. If you have any inflammation in your body, you tend to eat less, because some of the product that caused by this inflammation in the body also depresses your appetite. And dysphagia, or trouble swallowing, is the 50% cause for weight loss in elderly. It means trouble swallowing in diabetes mellitus, because of nerve problems, Parkinson's, then the scleroderma, or achalasia. It's a disease of the esophagus, that lower end gets tighter, so food doesn't pass through. It is a simple thing that you can do to fix it. You have to see a gastroenterologist for that part. They will complain that food gets stuck in my throat when I eat. Disease like a thyroid problem, overactive thyroid, can cause significant weight loss along with renal failure, COPD, cancer. So anytime you have a weight loss, you have to make sure that you rule out cancers. And we do that. And the drugs is an issue with anything else. Cholesterol medicine is known to cause weight loss. And some of the blood pressure medicine will do that too. And I'll come back probably later to talk about some of the medication that can cause this problem. How do we know that somebody has malnutrition? So one is not eating enough, losing weight, at lost 10% in 6 months, and muscle mass is lower, and losing fat, and there's swelling of the legs or edema because of the malnutrition. Your protein level went down, and so body is trying to compensate or not compensating anymore. So you're getting leg swelling and decreased strength, and they fall. So these are the clues that probably patient has malnutrition. Then you look into this. In the United States, almost 22.8% has some sort of malnutrition.
Wow.
Not always calories, other
No.
things, nutrition-wise.
Protein.
Yes. 1/3 of all hospitalized patient has malnutrition because our priority is to treat the patient's disease. Sometimes we forget to feed them.
Feed them.
And so we have to make sure that patient is fed and they go home better than they came in.
And the outcome actually of any disease changes tremendously once they are undernutrition or malnutrition. So there are various terms we want to kind of emphasize a little bit. One is, of course, big is malnutrition. There's undernutrition. So when you're not getting enough nutrition, then there could be stunted growth where the growth is not as much as for that height and weight. And also about malnutrition is important is calorie malnutrition, and then there's protein. So those some of the symptoms are totally different. And one of famous one was actually beriberi. So I don't know if a lot of people remember that happened I remember from ship, and they were eating rice all the time, and then they had these malnutrition from protein. So that's a very famous story. Pay attention, because the importance is there are different portions of these nutrients. So there could be undernutrition, vitamins, minerals, and so forth, and that can cause problem with still come under same umbrella.
Yes, we can emphasize on social isolation, like with the infection nowadays, and people are eating by themselves. And as you get older, more people are eating by themselves, but because there's nobody around. 1/3 of the people over age 65 eat alone.
Oh, that's sad.
And over age 85, it is almost 50%. They did a lot of study on this to see how much they eat when they are among other people. They always ate better when with their friends or family.
Wow.
And so it is a direct relation between group eating and eating by themselves. Even in a nursing home situation, when they go out and eat in a group, like a dining room, it is a better thing than
eating in the room.
In a room. And not only that, there's a lot of consequences, like they become weaker, they have more blood clot in the legs because of
they are not moving around.
Yes, dehydration and infection, depression. So you have to make sure that patient get fed or ate well at home. And you asked me earlier that what happens our aging process, natural thing that happens to our body. One is that anorexia of aging, that is nothing tastes good, and it is gastric emptying. It means that when you eat something, it takes 2.5 hours to get rid of half of the food from stomach to the intestine. In older people, it slows down. So it stays in your stomach much longer.
Much longer.
As long as it stays in your belly, you don't feel like eating. So next meal, they will not eat enough because they don't feel hungry, because there's some of the hormone that controls this mechanism are activated because there's a food in the stomach. And so it's important that you give time them to eat and understand that taking small meal, probably frequent meal, is probably better than getting a large meal because it's going to sit in the stomach too long.
Yeah.
And it also makes your insulin resistance. When insulin resistance happens, your muscle breakdown.
Yeah.
And also there's a reduction of the estrogen and also testosterone. Both are good for muscle buildup. So they become weaker on that ground to not only eating or things like that. Sometimes people will come to me and says, can you run me some test? Why I'm losing weight?
Yeah. That's
It is almost like looking for a needle in a haystack. And but you can do some basic test like CBC or blood count that we do, your complete metabolic panel that we do all the time. You add one thing, that LDH, and test for the thyroid, TSH, and the CRP and SED rate, as you say, it has a marker for inflammation that also can cause weight loss. If you think about cancer, this test will give you some clue, not always. Like your blood counts will be high, your LDH will be high, your albumin will be low, and alkaline phosphate is over 300. Then you know that something just not right.
Yeah.
So, but you can do CAT scan of the belly or chest because it's become cheaper and people get CAT scan all the time, although it's not the right thing to do because you get a lot of radiation for one CAT scan.
Yeah.
So what we do?
Yeah, what we do. Let's say we have.
So now we got a diagnosis that, it is you ruled out all the infection, all the other causes. Then you give them smaller meal and frequent meals.
Okay.
And you give supplements like a nutrition milk or a soup, anything over the counter you can buy. I don't want to name some. Some of them are available, and you can see on the television all the time that talking about nutritional supplements, how they're strong they feel. And it has 250 calories approximately and high protein. So that is not good. It's not bad, but I think we should try to eat food more if possible. Sometimes just keeping enough food at the home, prepared meals you can buy. You can keep it in the refrigerator. If you're not up to cooking that day, you can just eat something, not starving. And you can set up some home delivery system that will bring the food every week, every other week. They call Meals on Wheel. And there's a service, they will bring a meal every day that is good for 2 meals. And I have seen it, it's enough meal for 3 or 4 meals. So if you should not lose weight on that, eating that meal at all, unless you have some other disease. And we have to give some time to eat. You cannot rush them to eat faster because they will not, it can't. They rather leave the table eating half because they want to be out of the table. And in nursing home, it can happen, but as a nurse caregiver, we have to know that older people needs longer to heal, and also need some help to feed them. And they might need B6 vitamin, B12, iron, calcium, because these are not well absorbed from our gut system as we get old. So some people will need extra vitamins or supplements, like who has high metabolism. They break down your energy, need more energy. It's like a chronic lung disease. You call Parkinson's, cirrhosis of liver, kidney failure on dialysis. So those people will have to put special attention to give extra calories because we know why they're going to lose weight.
And that is such an important concept. Is malnutrition can also happen if you are feeding but the demand is more. like Dr. Jamil indicated. So if you are getting dialysis, and also if you have thyroid problems, so if there is hyperthyroidism, then your metabolism is really fast, and then guess what will happen is that you will develop malnutrition, even because you can't keep up the pace. If you do keep up the pace, then you don't lose weight, which is good. So it's also important that high metabolic states are important. Also, certain people, if they drink alcohol, their vitamins are more needed. They need to take extra vitamin, otherwise they will develop vitamin deficiency. That will be considered part of malnutrition, and they will have permanent damage to the brain. So those are very important concepts. Very common we see is with alcohol here, and also with now a lot of people actually take a lot of vitamin B12. Everybody is on B12 whether they need it or not. But what about the other vitamins? I always tell them, worry more about water soluble, which is vitamin C and B1, because those are the ones which people don't store more than a week. Okay, so you will run out of those first, then fat soluble, which is vitamin A, D, K. So those can remain in your system longer than those other vitamins which we always forget about.
Yeah. If you come to a conclusion, yeah. I can say that it is part of the aging that we may face malnutrition some part of the life, and we have to make sure that we get enough nutrition to make our journey good for everybody, and our too.
Yeah.
And once you get malnutrition, it's very difficult to get over. Because you start to have a complication like a skin breakdown, this and that, infection. So you're almost like chasing it now.
Yeah.
So it is better to do this ahead of time. So as your saying goes, a stitch in time may save 9.
Yeah.
It applies to most of the thing in our life that we should think prevention is better. Like our one of the president. Benjamin Franklin, in one of his saying, was an ounce of prevention is worth pound of cure.
Yeah, that's true.
And I liked him because few things that always intrigued me about our president is that he didn't go to school. He went to go to school for 2 years, formal schooling, and he became a very successful man in his life. He established University of Pennsylvania.
Wow.
And so he did a lot of things for United States. He is a learned man. And I think we should learn that an ounce of prevention is worth a pound of cure.
It's always important.
Thank you.
Thank you, and thank you for watching our show. This is Dr. Mobi checking out. But don't forget to send us comments. You can't, then at least email. Please remember to do all this and give us feedback. Dr. Mobi checking out. Thank you.
Thank you.